The sound of ambulances blaring horns pierces across Kampala's haunted streets as COVID-19 patients are rushed to hospitals. The ambulances are scarce and many critically ill patients require properly equipped ambulances. But many can't afford to hire an ambulance as it costs up to 1 million shillings. During the peak of this second wave, Mulago, which is the national referral, was inundated with patients seeking intensive care unit beds. New referrals were routed to Mandela National Stadium at Nambole, fitted with a capacity of 1,300 standard beds. At this Mulago mortuary, the stench of death permeated the precinct for 2 weeks. With the restrictions on burying victims of the virus, mortuary attendants could be seen recommending grief-stricken relatives contacts to funeral service firms who had camped at hospital mortuaries.
In the first wave, we were admitting all cases, mild, moderate, severe, all were admitted. In the second wave, we are only admitting severe and critical. But also the overwhelming numbers of critical cases was not expected because no country could predict the course of a variant in the country.
Uganda's COVID-19 response in its early days received global plaudits when the country, whose health workforce has immense experience in dealing with pandemics, registered a few cases as the regime enforced stringent lockdown measures. Earlier in 2020, when the country registered its first case on March 21st, followed by a few community cases, government imposed a lockdown to buy ample time to prepare the ground adequately, to plan, procure vital equipment, and equip the weak health system long ignored by policymakers who had a special fund that enabled them to seek treatment either at private facilities or routinely fly abroad. During the first wave, the number of patients gradually slowed as hospital beds were freed. With the declining numbers, the public knew that the country was out of the woods. In a year which coincided with party internal elections, some warned that to be able to combat the spread of the pandemic, the general polls in 2021 should be postponed. But during high-octane campaigns to elect party flag bearers and later parliamentary and presidential campaigns, large crowds gathered to listen to politicians without observing safety measures like wearing a mask. There are fears that by the end of polling on January 14, 2021, these events had worsened the spread of the virus. By the time President Museveni imposed the second lockdown on June 18th to contain the resurgence in the COVID-19 caseload, the virus had barreled deep into communities, including in the countryside.
At the beginning of the second wave, almost every old person that we admitted at a center here gave a history of attending a burial. Most of them would say, I went for a burial, whatever, and 1 or 2 weeks down the line they admitted here with severe COVID-19. So that is one area where this virus sort of went through the region of Teso.
The second wave further placed the country's ailing health system into a chokehold as patients suffered from new deadly strains of the virus, including Delta, which is highly transmissible. Between late May and the first 3 weeks of June, the country registered the highest number of cases in a single day, 1,259 or 17% positivity. With the public health facilities overwhelmed, desperate caretakers and patients turned to private health facilities, which charged exorbitant prices. Unethical conduct and lack of compassion was the order of the day as hospitals across the city detained bodies of patients whose relatives failed to clear bills. So how did the country find itself engulfed in this COVID-19 maelstrom? The first lockdown last year was supposed to provide government with enough time to borrow enough funds and equip its healthcare system. It was also meant to allow health institutions to train specialized nurses to provide care to critically ill COVID-19 patients. The health minister, Jen Ruther Cheng, told NTV they tried their best.
We did inform the population that variants are coming in. Variants came in through the border points of entry as well as through the airport. If Uganda did not have a mechanism, then we would not have detected that variants are coming in. However, even after we announced that variants are in the country, and within a period of 2 to 3 months, we will see an upsurge in cases, many people did not take heed. There was very low following of the standard operating procedures.
Oxygen, one of the key components in treating acute COVID-19 cases, became scarce and in other instances commoditized way too costly for ordinary majority Ugandans. At various regional referral hospitals, fatigued caretakers could be seen carrying cylinders from refilling stations to treatment wards,
whereby they have to rotate a cylinder from the ward to the place where it is supposed to be taken. The same to bring while either carrying on your using your either your head or just rolling until you reach there. That is one of the challenges that we are seeing.
Inside treatment wards, the situation was mostly frightening as patients fought for their dear lives. Investigations by NTV show the situation got dire, especially at night when several health workers were resting or many were off their shift. It was further worsened by the few critical care nurses who work in ICUs. This is the view of Dr. John Wilson Etolu, the head of the COVID-19 treatment unit at Soroti Regional Referral Hospital.
Each of every patient that came out of an ambulance needed oxygen. And it came at a time when oxygen was also very difficult to come by. We didn't have enough oxygen for all of them. We didn't have enough oxygen delivery equipment for all of them. Some of them were very old people with severe illnesses.
Between the first lockdown in March 2020 to June 2021, the Health Ministry received funding from the World Bank, Global Fund, Gavi, among others, amounting to 750 billion shillings, of which 617 billion shillings, or 82%, had been spent by March 31st, 2021. Of the 750 billion shillings, government's component was 240 billion shillings, of which 22 billion shillings was spent on procurement of face masks and 594 million shillings on distributing them, 35 billion shillings on procurement of ICU beds and accessories, 29 billion shillings on procurement of test kits and reagents, and 22 billion shillings as allowances for health workers, among others. Specifically, a 6.4 billion shillings tender for oxygen was handed out to MS Silverbacks, a company registered to President Museveni's daughter-in-law, Charlotte Kainerugaba, and her sister, Ishta Asimwe. The contract provided for, among others, supply and installation of oxygen equipment at Mulago and Entebbe hospitals, a 2-year warranty including spare parts and maintenance for 3 years, and 450 cylinders including regulators, humidifier bottles and cannulas. A yet-to-be-released Ministry of Finance audit into COVID-19 expenditure, a copy seen by NTV, details that delivery and installation of 4 oxygen plants was done at Mulago Specialized Hospital and at Entebbe Mbarara Regional Referrals respectively as last December. However, the oxygen filling station at Mulago and the oxygen plant at Kayunga Regional Referral Hospital were yet to be delivered nor installed over funding constraints. The report further details The 4 oxygen plants installed at Mulago need urgent maintenance barely a year later.
All the regional referral hospitals, in addition to the oxygen plants, got additional cylinders, which were procured and made available. We prepared, but you can never prepare enough because you don't know how many patients or how many people will be infected. His Excellency the President directed that we prepare for the worst case scenario.
At Soroti Regional Referral, which until the second wave struck, had undergone years of deliberate neglect and chronic underfunding, officials revealed that they had both improvised for oxygen or wait for supplies transported 350 kilometers from Kampala.
I think we did not prepare very sufficiently for the second wave. I'll give just one example to show how, maybe in my view, how we should have prepared. I think that the key commodity, the key drug for COVID is oxygen. And the key challenge in the COVID fight in the second wave is just oxygen, really. Oxygen has been the greatest problem in my view. So I think that we should have prepared more.
The hospital's oxygen plant, with capacity to refill 5 cylinders in 3 hours, was way too slow to serve critically ill patients. Doctors explained that, averagely, oxygen consumption for non-critically ill patients stands at 1 to 15 liters, while patients in critical condition could consume an entire cylinder of 60 liters or even 2 cylinders per day. In April 2020, the Health Ministry acquired 20 100-capacity sleeper tents, each at 163 million shillings, or a combined 3.8 billion shillings, the tender handed out to Lumias Uganda Limited. The tents were supposed to be installed at Nambole to create a large patient holding point, but the stadium management refused the ministry from puncturing the stadium turf, rendering the tents unused, so they were dispatched to various regional referrals. 2 tents were installed at Soroti but have barely been used. The first tent, officials explained, required a concrete floor to be constructed but had not been planned for, while the second tent installed on a lawn wasn't functional because of low electricity supply. When the hospital COVID-19 treatment unit was at its peak, management improvised space 1.4 kilometers away at the Soroti School of Comprehensive Nursing. Similarly, last year, the ministry handed out 2 tenders, 26.9 billion shillings to Elsmeed E&A Limited for delivery, installation and commissioning of ICU equipment in 17 hospitals across the country, and the second 10.5 billion shillings handed to joint medical stores for supply of ICU beds and accessories. 5 ICU beds were delivered to Soroti Regional Referral Hospital, but there was no space to accommodate them. The hospital, established in the 1920s, first as a treatment facility for syphilis and later upgraded to a district hospital in 1977 and as a regional referral in 1996, comprises of mainly decaying buildings that couldn't hold heavy ICU equipment. The Health Ministry is currently remodeling a new building to hold the new ICU equipment. But after delivery of 5 ICU beds and the associated equipment, it also dawned on management that they did not have intensivists, certified physicians who provide special care for critically ill patients in ICU. When the second wave worsened, the hospital sent 12 nurses for training at Mulago, due to return later this month. On the day we visited the hospital, we found several supplies dispatched by the Health Ministry, including beds and mattresses outside the COVID-19 treatment unit, as there is no space to accommodate them while officials try to prepare the 2 tents dispatched last year. According to the finance report as of January 31, 2021, some 1,497 out of 1,553, that is 96.4% pieces of equipment procured had been delivered to the respective recipient facilities, and 85% of the installations done by both Elsmeed and joint medical stores. These included, among others, blood gas analyzers, defibrillators, suction and infusion pumps, nebulizers, mobile X-rays, oxygen concentrators, weighing scales, portable ultrasounds, patient trolleys, ventilators and ICU beds. By January and February 2021, the report shows the laboratory equipment such as blood gas analyzers supplied by Elsmeed Limited was not working, while equipment delivered at Soroti and Lacho Hospital in Gulu did not work at all, and one delivered to Gulu Regional Referral Hospital worked for less than 48 hours. The equipment had flaws related to sensors, temperature failures, and frozen screens, among other issues. However, the Health Ministry told the report authors that these flaws had been fixed in March, save for the Soroti Regional Referral Hospital. At Soroti Regional Referral Hospital, the report shows, and doctors lamented about the lack of uninterrupted power supply, which affected functionality of blood gas analyzers. This intermittent power supply, despite the country's hydro generation capacity, resulted into the death of patients in ICU, including at the Mulago COVID-19 unit. The report further details that joint medical stores supplied inferior equipment, which the organization denied. In a statement to NTV, Joint Medical Stores Executive Director Dr. Bildad Baguma said, and I quote, "They supplied high-quality equipment in line with the specifications shared by Ministry of Health, in addition to, among other, sale packages, including 3-year manufacturer's warranty, covering spares and labor, and lifetime free equipment service and repair package for all the medical equipment." At the northeastern tip of the country, at Moroto Regional Referral Hospital, the COVID-19 focal person for the Karamoja sub-region, Dr. Moses Okwir's story parallels with the counterpart in Soroti.
And the second wave kind of caught us slightly unaware. We detected mostly through testing. So it had found that we were reluctant in some of the areas.
The hospital is also grappling with a shortage of frontline health workers amidst a surge in patient numbers.
Because generally this place is lacking specialists, that is something that is known. So in our COVID treatment unit, the ICU, we lack the intensivists. So that is the challenge we have. Then the normal human resource, the one we had in the first wave, we are still pretty much working with them.
At Imbale Regional Referral, health workers speaking anonymously said the delayed payment of risk allowances had affected their morale, but the hospital director said this had been addressed.
Yes, it is true. They had taken long without getting their allowances, but their allowances were compiled. And I'm glad to report that now my staff, their allowances have been paid up to June.
The hospital also experienced a glitch in oxygen and shortage in frontline workers.
You may find one patient in an ICU to be attended to properly would need maybe a dedication to about four nurses to one individual, which luxury we don't have yet.
But how did things go wrong when Uganda appeared to be making strides in the fight against COVID-19 compared to neighboring states earlier on in the year? Why did those in charge not rely on the first lockdown as the saving grace to fully equip hospitals in time?
One of the MPs said COVID is going to be the 7th killer disease. I like that. So it's going to stay. So that means we have to plan for it like the way we plan for TB, the way we plan for HIV. Every year HIV is planned for. Pick the clients, the Ugandans, and then the government. So we need to think about that. We need to get not like a new thing. That's the best way, because we always have resources. We have the brains, we have the preparation. But when you sleep off a little bit, that's what happens.
Whatever has happened to Uganda is not unique to our country. It has happened in many other countries as well, including the first-class countries. But if I were the PS, I would improve. I think because I work at the region, I would strengthen capacity at the regional referral hospitals. One would be to improve the capacity of the oxygen plants at the regional referral hospital to even have greater capacity. Two, we would make sure that we recruit more human resource to curb the pandemic. Three, we would put a lot of emphasis on educating the population. As I speak now, in the Teso region, people are doing all sorts of things, including steaming with cow dung and taking urine and eating all sorts of things because of the desperacy.
So the preparation was done, but like many other countries that experienced the second wave, you also how they were overwhelmed. There is no country that can stand up and say we were not overwhelmed. Ministry of Health continues to prepare even for the third wave, because there will be a third wave.
Well, the country's COVID-19 death toll has clocked 2,286. All is not entirely despair, as over 65,083 patients have recovered out of the total caseload of 89,514, as health workers have placed themselves in the harm's way to save lives. But the country is not yet out of the woods, as the third wave is imminent and could as well get the country ill prepared.